This video is an initiative of Plastic Surgery Research Council, Educational Committee. My name is Cristina Camargo. I'm plastic surgeon in Brazil, University of Sao Paulo. Hi, if you are considering to do a systematic review, I think this video can help you. A systematic review is different from a narrative review. In a systematic review, you have to follow steps systematically, and they have to follow a lot of rules. This kind of attitude will lead you to extract the best evidence from data literature, and ultimately you help your patients. As in a normal or in a primary study, you have to think about your research question. A good tip, you have to think in terms of PICOT or PECOT format, where P is for population, I is for intervention or exposition, C about a comparator, O outcome, T about time. According to this your research question, you begin to plan and begin to build your protocol. So, first thing first, you have to put some limits in terms of time and in terms of language. We know that most of papers are written in English, but sometimes in a not English papers you can extract value information to put it in your systematic review. Another important point is the choice of your study design. Because we are dealing with intervention, you are a surgeon, the best evidence sometimes is not possible to do a randomized clinical trials. So another possibility, you can design or you can choose quasi-randomized trials or observational studies. In this case, observational studies is about case control cohort. Case series is not good for your systematic review because you introduce a lot of bias. Going to the planning, you have to think about eligibility. So you have to think about in terms of inclusion and exclusion criteria, the unit of analysis. In your systematic review, your unit analysis is about a region, a patient or region of the body, for example, in a split face model. The endpoints is so important as in a primary study. In a systematic review, primary outcomes, endpoints, can be related to efficacy and safety in terms of major adverse events. Secondary endpoints is also related to efficacy and effectiveness and safety about minor or moderate adverse events. With all those things, you have to think what a kind of database you will choose. You know that the classic one, you have to look for Medline, Embase, Lilex for Caribbean and Latin American database, and the Cochrane literature, because sometimes you don't have need to do more systematic review. Another interesting database is the private one. For example, Scopus, Web of Science, or American Association of Psychology. You have also to search for ongoing studies, so it's good to go to the clinical trial register sites. It's interesting to note that gray literature is also important for systematic review. Here I have some sites that you can search for gray literature. The importance of gray literature, that they think about avoid publication bias. After that, you have all your studies and they can use some kind of tools to look based on the title and the abstract what you include or exclude in your primary selection. This selection will be done for 2 authors, and if you have any disagreement, a third author can solve this problem. After that, you have your protocol ready and you are ready to register. Like in a primary or the randomized clinical trials, you have a specific sites. For systematic review, Prospero is the place to register your paper. Then, most important things, critical think. The authors must think in terms of the study that you select have similar population, similar inclusion and exclusion criteria, similar intervention endpoints, because it is important for homogeneity and heterogeneity. So, the important work in this phase is GIGO, garbage in and garbage out. Because of this exercise, you will extract primarily for the database. You have to exclude some papers based on the title and abstract. And now you call this for records. After that, you have to see and check the full papers. And you select. Now the name is studies. And when you exclude, you have to give reasons for this exclusion. After that, you have amount of select studies, and you're ready to do a qualitative or a quantitative analysis. In the data collection, I advise you to create an Excel spreadsheet where you have to put important information like study ID, study characteristics like multi-center, randomized, open label, what kind of population we're dealing with, intervention, comparators, and the endpoints. And after you fill in this spreadsheet, you have to consider each risk of bias for each study. So, if you are dealing with randomized clinical trials, the best tool is ROB that was created by Cochrane. If you are using an observational study, the best risk of bias scale is Robinson Newcastle Tower. Systematic review, you can also have an overview systematic review. So, the tool is ROBI, and so on. For example, if I am considering to analyze risk of bias in randomized clinical trials, I will use ROBI and I will check these domains about selection bias, performance bias, detection bias, attrition bias, and data report bias. How I can interpret this study? I consider a low risk if the studies, all domains were classified as low risk. An unclear risk, some domains receive an unclear risk of bias. And a right risk, at least one domain receive a high risk of bias. In case your systematic review is about no randomized clinical trials, you have another tool, for example, ROBI. And in this case, randomization is not be able to analyze because they have no randomization. So the aim of this tool is to analyze possible bias related to pre- and during intervention exposition and post-intervention exposition. After that, you collect all the data, and if you have some homogeneous, some similar papers, you can do statistical analysis. The most important is meta-analysis that compare two or more studies. So you have to check about statistical heterogeneity, and you define if you use a fixed or random effects. Most of the times, random effects is best because you don't have a perfect homogeneity between the studies, and you create a forest plot. Another thing to consider is subgroup analysis, sensitive analysis, meta-regression, funnel plot that we will discuss later on. This is the output of a classical meta-analysis with 3 studies. Here I want to show you where you put the raw data according to each group and the presence of events and the total number of patients or units allocated. Here you have to show to your reader what a kind of effect size you are using, for example, risk ratio, and if you will put a weight for each study, what a kind of random fixed or fixed effect that you use, and here you can calculate your confidence interval. In this right part of your output, you see the classic forest plot that will lead you to the final effect of your comparison. Another important thing to think about is the subgroup analysis, to assess if one population on a subpopulation can show different outcomes. But take care, a lot of subgroup analysis can produce or can cause error type 1. Meta-regression, you can do like an association. You analyze one or more factors that association with the results. A tip for you that you only are allowed to do a meta-regression if you have more than 10 studies. Sensitivity analysis. Sometimes you have a treatment that's not be used, or you want to see if you take some paper, you have different results. That is the difference of supergroup analysis and sensitive analysis. And finally, to check publication bias, you do perform a funnel plot. The funnel plot is allowed if you have more than 10 papers. If you need more info, please go to the PRISMA, the checklist and guidelines for systematic review, Cochrane review, and try to use a very interesting tool for perform a systematic review, RevMM. Finally, I want to show up that systematic review is different from narrative review. When you are beginning to work, think in terms of PICOT or PECOT. Planning is a very important step. And when you finish your planning phase, go to Prosper and register your systematic review. Follow PRISMA checklist, and after data collection, think if you are able to do a qualitative or a quantitative analysis. If you get a quantitative analysis, the first thing to do is a forest plot. And if you have enough papers, a subgroup analysis or meta-regression or sensitive analysis. Thank you for passing by.